Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob SCHRUPP, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Welcome, folks. This is the Total Knee Replacement Fitness Program. I'm Alex, Physical Therapist Assistant.
I'm Mike, Physical Therapist Assistant.
And this is exercises after surgery, 0 to 4 weeks along. So,
First month of exercises to do on your own.
yes, it is. Now, the goals, there's 4 goals of this period in your life after knee replacement. And number 1 is monitor your swelling and pay attention to signs of infection. These signs of infection: redness, warmth, swelling. It could be drainage coming out of your incision. I mean, these are all things that you
And
need
the
to keep track
problem
of.
with the knee replacement is you have all those signs anyway.
Yep,
So it's
yep.
not always easy to spot that.
Right.
But if you're concerned, just call your doctor and they'll kind of reassure you if it's something bad or not.
Yep. And pain will tell you a lot. If you're having more and more pain as you go, I mean, that's usually...
Or if you're doing good for 2 weeks and all of a sudden your pain gets way worse all of
Yeah.
a sudden, that's a common sign that something might be wrong.
When in doubt, contact your medical doctor with concerns. They'll never say it was the wrong move. So,
Yeah.
number 2,
Increase your range of motion, so your bending or knee flexion and your straightening. This is going to be the biggest exercise you want to focus on, are different bending and straightening exercises we'll kind of show you later in the video.
yep. And
So-
number 3, not as important as Mike's number 2 here, but regaining your strength, starting to regain your strength, teaching your muscles how to contract again. I mean, that's a big goal of this stage.
Yep.
Lower level exercises, and we're
Yep.
going to get into that.
Range of motion should be your biggest priority. Once your range of motion comes back and you can move easier, your strength will typically come back sooner.
Yep.
So focus on range of motion first, then focus on strengthening as you can tolerate.
Yep.
Number 4 is normalizing your walking mechanics. We will kind of show this near the end of the exercises, what a normal walking pattern look like, and kind of how to do stairs as well.
Yep.
So,
It's going to be rough to start, but you're going to get back into it. And note, pain medication is very important in this stage. You want to probably take your pain medication about an hour prior to doing these exercises so it's fully taken hold, and I mean, you can progress as you need to.
yep, initially you'll probably be kind of on a schedule for your pain pills, what your doctor kind of recommends. You can start to wean down as pain is less, and maybe just take them before exercise. And a lot of people will take them before they go to bed eventually, but figure out what works for you or what your doctor recommends.
But it's very important. All right, get into exercises. Mike's going to demonstrate. He has shorts on here.
Yep.
Number 1, these are called quad sets. This is kind of a starting point for strengthening and also range of motion, getting your
Yes.
knee straight. So,
I'm going to lay down. We'll say my right side is my
sure.
surgery side.
So, all Mike's going to do here, he has his leg as flat as possible, and he's just going to tighten this muscle here, his quad muscle.
Going to push down into the mat.
Yep, and he's pushing down into the mat. He's going to squish that bug that's under there.
There's a bug.
Well, no.
He's going to bite me.
Don't freak out. And he's going to hold it for about 5 seconds.
2, 3, 4, 5.
This is
relax.
quad strengthening as well as knee straightening range of motion. So this is a good starting point for getting your knee to be straight again.
Add your Mississippis to your 5 because a lot of people go 1, 2, 3, 4, 5.
Yep. Yep. Don't
Like
get too caught up on the counting.
Like
you
a
know.
certain coworker of ours likes to do.
Sure. Don't get into that, Mike. All right. This one, number 2, is supine, or laying on your back, hip abduction. So basically it means
This will be more for a normal size bed, not this little plinth we
Yep.
have, because I am going to be limited on my motion here.
so hip abduction just means your hip out to the side.
You're going to have to slide it more that way for me.
More this way.
We're doing it with the knee glide. If you happen to have one of these, you
Yep.
could check it out on BobandBrad.com. Imagine there's 2 Brads.
If you don't have the knee glide, you actually have to lift your foot up,
Yep.
your heel up off the mat,
Lift it up.
which, you know, early on it might be too hard to do. So the knee glide is really helpful in this situation.
Yep. So try to keep it on there. You could slide it along your mattress. Maybe it's going to be a little harder
Yep.
to move.
Or
but
if you needed your leg lifter early on, you could.
Yep. You
use
can
that
hook
too.
it on there. Grab the handle. Wait, this one's fresh. It's
Fresh.
a new leg lifter. You can lift it up and then
Out
kind
to the
of
side.
use your hip abductor
Yep.
muscles to kick it.
It's
out the
working
side.
a little bit on your knee straightening, but we're strengthening your hip because all your muscles in that side get weak when you have a surgery because you're
Yep.
favoring it. Number 3, heel slides. Now we're going to get into the bending range of motion here. So
Yep. This
we're-
is your knee flexion. This is one of the most important ones we talked about. It was goal number 2.
so you're probably going to start out with it down here early on.
And just bring it up to what's comfortable. You can
Yep.
also do this with just your socks on your bed if you want.
Yep.
If you don't want to get a knee glide. It makes it a little easier and more convenient with the knee glide there.
Yep.
So just bring it back what you can. If you need to add a little extra oomph, if you can, if it's not painful, take your other leg and just
Yep.
push a little, hold it for a few seconds, and
And that'll probably
release.
be more to the 2-3 weeks. I mean, early on. If you need the leg lifter again early on, you can use that as well.
Yep, so I can just hook my foot on there. I can use my arm to help pull it up if it hurts too much. Just get what's comfortable.
Yep.
Try to make sure your knees align. Don't try to go out or in too far. Try to keep it straight in line. when
Yep.
you're doing
And
this.
nice and slow. It's not a race to get repetitions. It's all about
Yep.
bending the knee.
And when you bend it, you can try and hold it there for like 5-10 seconds. What's you can tolerate.
Sure.
Don't forcefully shove it back. Just go to where pain tells you and just kind of hold it there.
Yep. I'm going to say these next 2, number 4 and 5, these are going to be the most important exercises of the bunch here. So,
Yes.
all right, I'm going to grab a chair in the knee glide. So I'm going to sit in the chair here, and I'm going to use the Bob and Brad knee glide. This is number 4, and this is just simply putting your foot on the knee glide and getting it bending. Again, it's not about speed. It's about every day trying to push it a little further underneath you.
So 3 and 4 are the exact same concept, the same exercise, just different positions.
Yep.
And you just figure out which one works better for you. We have had patients, oh God, we know like what, 10 different ways you can bend a knee?
Oh, yeah. Yep. Yep.
We figure out which ones work for which person. Everyone's
Mm-hmm.
different and can tolerate different things, how they want to do it. These
Yep.
are 2 of the easiest options to pick from.
Yep, easiest and most effective, I mean, for the general public.
Yep. Again, put a towel on the floor if you have wood floors, if you don't have a knee glide. So,
So that's 4, that's working on bending.
yep.
And then 5,
Is extension
Yep.
stretch.
just simply, this is a good one to watch TV. You put your foot up on a stool and you let gravity push down on your knee to
You
straighten
can
it out.
also do this one laying down, which I'll show here in
Yeah.
a few seconds. But this is just getting your knee straight. Everyone has one way that's harder than the other. Typically, some people it's bending, some people it's straightening. Rarely do people have both without pain right away.
Yep, yep.
So,
And work up to this one, work up to doing it like 15 minutes. You might only be able to do it for 2 minutes to start,
Yep.
or maybe 30 seconds. That's fine. Work up to doing it for
You
about
can
15 minutes.
also ice your knee while you're doing this.
Yep.
Kind of get a double whammy at once. If you want to show it laying down, so you could put something under your feet maybe,
Yep.
more towards your toes.
I'll
Boy,
put the pillow.
I keep getting on my cord. I see how Brad has all these problems. So it might be bent like this far. Just try to let gravity relax until it can kind of go straight. I
Yeah.
hyperextend a bit,
Yep.
but if you prop it up on towel rolls or a pillow, it'll just help extend it a little more. You can even do it without the pillow by your feet initially.
Yep.
But this is just another option when you're laying down.
Mm-hmm.
So
Yep. All right, and then number 6, Mike's here, so I'm going to take the pillow from him. This is, oh, he wants it for his
for my
head.
head.
He's going to do straight leg raises. So he bends up the opposite leg to take pressure off his back,
Okay.
And he's going to quad set the
Quad
first
set.
one. Tighten, tighten, tighten. Keep it straight. And then he's going to lift the leg. Now, if you can't do this the first couple weeks, don't be discouraged. It's going to take some time. It takes a lot of strength to be able to do a straight
Yep.
leg raise.
Quad set. Lift up.
Yep.
My quads are working, and my hip flexors are working as well.
And you want that leg completely straight is the goal. You might start out, show a little lag.
And go, a little leg.
So you might start out like this, where your knee is a little bit bent. You don't have the strength. That's okay. You know, work up to it.
Yep.
Just don't go so high when you lift it.
Yep, and then as time goes on, you know, you might be able to get to here. If you get comfortable, you know, you can almost go even with your other leg. You don't have to go way up
No.
here. That's tight.
I'd say even with your other leg is
Yep,
just
even
fine.
with your other leg is probably as high as you need to go.
Yep.
So.
All right, number 7. Watch your mic there. It fell out of your
Oh
pocket.
my goodness.
Number 7 is gait training or walking training. This might seem silly. You know, walking is walking. I've been doing it since I was born.
Yes.
Well, since you were a year
you have
old.
been?
Since you were a year old, but you know, this is going to change the game. You have to kind of learn to walk again. So your proper mechanics, you know, imagine I have a walker here. The first week or so, you're going to be really hobbling on that knee.
I have a cane.
Oh, thank you. But after that, you know, and you're probably going to be in pain, so you're going to be just stepping to your other foot for a while. God, I'm bad at acting like I have pain, don't I? But eventually
You
we
look
want
pretty
you
good.
stepping through, you know, stepping past like you would normally walk, and also hitting with your heels. That straightens your knee.
And letting your leg go straight as you go back. A lot of
Yep.
times what happens here is if they lack knee extension, take a short step once.
On the side?
Yeah. Well, you know what I mean?
No.
So if you're trying to step through and you can't extend out of the
Oh,
way,
sure.
people tend to hike it forward
Yep.
faster like
Yep.
this.
Yep. And also focusing on the back leg, doing a little bending.
Yep.
So, and early on, you're not going to want to put a lot of weight on your leg. You're going to be using a walker, so I mean, you're going to have that hobble, and that's another thing you got to work on is putting more weight through your leg. You know, you might start out with 50%, working up to doing 100%.
Number 8.
One more thing.
Oh.
Don't rush getting rid. Don't rush getting rid of your walker, or whatever you're using. I mean, because you need to use that until your hobble is completely gone, pain is under control.
Yes.
Don't rush it. All right.
And don't
Go
try to walk too much too fast.
Right.
We'll get into that later.
Yep.
But number 8 is stair training. So we do not have actual staircase right here. So we're just going to use a step, pretend this is the railing. So we're going to go up with your good leg. So if my right leg is my surgery side, you're going to go up with your good leg and use the railing. And then you go down with your bad leg or your surgery leg.
Yeah.
So what happens, you go down with this one first is because your good leg is keeping you balanced as you go down. So see how I'm bending here? If this was my bad leg, that would hurt and be hard and people just drop.
Yep.
So it seems weird to go down with your bad leg or your surgery side. What you do is control it and then go through.
Yep. The goal is to keep that leg straight when you're doing stairs because when it bends, that's when you're gonna get your pain.
Good people go up to heaven.
Alex to heaven,
Alex down to
Mike down to hell.
the underworld.
That's how we think about
You
it.
swore.
Oh, sorry. All right. So those 8 exercises for 0 to 4 weeks.
Yep. Good beginner workout. If you're past that phase, you can check out the next phase of our program. Or if you're before this or before surgery, check out some of the other videos in our fitness program.
Again, everybody progresses differently, so don't compare yourself to others.
And you can check out this and other programs on bobandbrad.com/programs.
Very good. Thank you.